everyone. I am Dr. Strickland, and I will be your professor for abnormal psychology. I'm so excited because abnormal psychology is my background. My background is in clinical and counseling psychology. So this is a course that I actually get to bring my practical experience, my academic experience into the course, and I absolutely love it. If you ever want to know what a psych nerd looked like, you are looking at the psych nerd, and have always been interested in psychological disorders, abnormal behavior, the mind. The mind has always been so fascinating. So I'm so excited to have all of you in class. So the prerequisite to get into this course of abnormal psychology was general psychology. And it's very important because you need that foundation, you need that baseline of the theories and the concepts that was talked about in general psychology to further that into a specialty area like clinical psych. This falls under clinical psychology, abnormal psychology does. If you're interested in the world of clinical and counseling social work, this is actually a required course. And so when we look at how this course is going to be focused and established, we're going to be looking at all of the different areas of mental illness, mental disorders, the criteria, the symptomology. So you're going to get all of that as we progress through the course. So what I want to do in this video is just kind of give you a little bit of a background about myself and the practical experience that I have in the field of clinical psych, and then a little bit about how the course is going to work and how I've always taught abnormal psychology. I have kind of a formula of teaching it, and it's been successful so far, so I think I'm going to continue to stay with that. First of all, my background. I have 3 degrees in psychology and 2 in education. And as far as an undergraduate, especially if you're interested in psychology, you basically just get the general undergraduate degree in psych. There are specialty courses that you can take if you kind of have an idea about what you want to go into. I've had students that take abnormal psychology and they end up going into social work. I have 2 former students of mine that just graduated with their master's in social work. So I'm so excited that they continued and with their educational journey. So that's, when we think about how that format works, it kind of starts you off. That undergraduate gives you that foundation. Once you get into grad school and then post-grad school, you kind of specialize a little bit more into the areas that you want to go into. We call them tracks. And so a lot of people who more focused on research may go into a general track, and then counseling and clinical. They may go into industrial psychology, educational psychology. There's just so many different tracks that you can go into once you go out there. My graduate's in clinical and counseling, and then post-grad is in clinical and counseling. So my entire educational career in psychology prepared me to diagnose and assess individuals, and then to go further to do treatment. And so we're trained, all of the courses that we have in grad school are trained towards preparing ourselves to go out there and work with people. So I've done all my practicums, my internships, my licensing internships in private practice, outpatient, and then lockdown psychiatric. And one of the reasons during my internship that I chose to do lockdown psychiatric facility is I wanted to see the worst of the symptomology. I mean, if you're going to diagnose someone with bipolar disorder, and if they're not in a manic episode, how will you ever know what that manic episode looks like if you don't see it right there and work with that patient? So, working in the psychiatric facility as I was working on my license really gave me a better understanding, so I can teach you what the symptoms really look like and how to work with these individuals. So I had that background through my education, working through all the different areas and outpatient to private practice and all that. Before I went back to school and all the degrees and all that, I was a professional marine mammal trainer. Some of you know that if you've taken me for other classes. I worked with all marine mammals, dolphins, the whales, sea lions, everything, which was a great experience to look at comparing dolphin behavior with human behavior. So that gave me a animal model to go by to look at that. I also worked at Miami Metro Zoo, where I worked with large cats, primates, birds of prey, everything. Wherever they needed me in Miami Metro Zoo is where they sent the trainers. So I have that huge background working with animals. And you know, in psychology, we use a lot of animal models. We look at behavior, say for instance, aggression. You know, I've worked with some primates that by nature are very aggressive animals. And so when I can look back and know how aggression works because of that innate aggression, how would you compare that to someone that might deal with psychological issues that has innate aggression or more aggressive? So that has helped me to have a better understanding of how human behavior, mental processes work, and how it goes a step further to understanding psychological disorders. So how we're going to work this course and how it's been successful. I was very fortunate because I started off as an adjunct at a university, and I actually taught abnormal behavior at 3,000, 4,000 level. And these were students who were preparing to graduate, preparing to go into grad school. And knowing that I had to help them prepare to go into grad school because they were going to take higher courses, and also knowing how licensing works, I set the course up where I would give them case studies. So you will see when you look at the syllabus that you're going to have case studies. I can't bring the patients to you, but you're going to be able to kind of practice how we actually go through assessing and diagnosing. So you will see that we'll have case studies in the class. We will also have quizzes, so we'll have the quizzes that will be multiple choice. Don't worry, multiple choice. But that will be more to your readings and to actual the symptomology and diagnosing. So that way it just helps you to kind of, you know, put that into your mind and know that there's this many symptoms to depression, or there's this many symptoms to schizophrenia, or this many symptoms to ADHD. We're going to go through the entire all the mental illness. So we'll have the case studies and we'll have the quizzes, but we'll also have discussion questions too, because I do get a lot of questions about diagnosing and about the assessment itself. Like, you know, I was told I had this, but do I really? And that's an assessment question. That's a diagnosing and assessment question. So we'll go through that process with our discussion questions. Now, I'm going to try this semester, because I do it in my N class. You may have heard of it. I'm going to try to do it online for you. I'm going to try to work this out. I do serial killer week in my class. Everybody picks a serial killer, and they bring that information to class, and we kind of do a pathway to becoming a psychopath. I'm going to try to figure out how I want to do it online with you guys. I practiced a couple of Zoom lectures this summer, so I may make it a Zoom lecture where we all just kind of go in as a group live, and we all kind of pick our serial killer and what we want to do. I'll kind of work that out as we progress. So we're going to do some discussions, have some great discussions, great topics. And we'll go through the discussions as we progress through each of the different disorders. So we'll have some good topics on that, and I'll try to figure out how we do serial killer week. That's going to be important. That's one of the first questions I get: serial killers. But I'll figure that out. If you haven't had a course before online, or this is your first time online, I really try to keep my classes very simplistic, because I want you to walk away going, wow, look at all that information. I didn't know that's what you had to diagnose if you had OCD. I want you to enjoy and learn the information, not worry about, you know, assignments and when things have to be turned in and where do I need to go to watch this. I'm going to tell you each week. Each week I will say week 1, week 2, and I'll tell you. And not only will I tell you each week, it's also on the syllabus as well. That's the first thing you should look for anyway. After seeing this video, go to the syllabus, either download it, print it out. I have a class schedule. So that syllabus tells you everything you need to be successful in the course, but that class schedule tells you each week what we're going to be doing. Now you'll notice, because we do have a new textbook, and I have the textbook information in the syllabus, I'm kind of going around on chapters. I kind of have a method of how I present abnormal psychology and all the different disorders. And so with this new textbook, they kind of had it out of order from the last textbook that I used. And so we may go from chapter 1 to chapter 7. Don't worry about that. It's really about all the disorders. But I like to start off, what is abnormal psychology? I have a discussion question. How do we define it? How do we go about assessing a patient? Having those conversations, gathering that information with the patient. And then I always like to start more with anxiety, PTSD, separation anxiety. Anxiety is one of the most diagnosed disorders on a daily basis. More people go in of anxiety issues than anything else. So I always like to start with that first. That's a good foundation disorder to start. And PTSD, as you know, is an issue that we have. So that's a good area to start. Then from there, I like to go to mood disorders because I always kind of think of depression and anxiety as like first cousins. And many people who are diagnosed with anxiety also end up with, dealing with depression as well. So it's kind of vice versa. So we'll go to depression, and then we'll go, we'll progress from there to our other disorders. We'll fit in personality. That's kind of a different area, and that's where we'll get into a little bit of antisocial personality, or what you call sociopath. So I think you're going to really enjoy the class. I'm excited that you guys are in class. I definitely will have some more discussions. I think the first discussion that I put up was defining abnormality. That's what I always like to ask students, because I think people come in with already lived experience and a definition in their own mind about abnormal behavior and abnormality. So I always kind of like to hear what students think, their own definition, and then we'll get into what we have defined as abnormal. So again, great to have you in class. We're just gonna have so much, fun academic education. Curriculum is all just amazing, exciting, and I love teaching abnormal psych. And if you have any questions, I have my number. I have my number on the syllabus. Please do not hesitate to text me. Even if you just want to text me because you just want to say, hey, hope you're having a good afternoon, that's fine. I think that's wonderful. If you have any issues, especially with the computer or anything, text me, let me know. This summer there were some issues where a student, had so much difficulty opening up a document. I got her straight to LTech. LTech, amazing people in LTech. And they had her fixed in like 2 minutes, and then she texted me back and said, oh my gosh, they fixed it. So please let me know if you're having an issue. I don't want you to stress. We're going to talk about stress. I'm having anxiety about it. I want you to enjoy the class. So again, excited. We have a great semester. Bye.